The number one question I get on my social media is, how can I get bigger? How can I get longer? Or how can I get more girth? Well, today I am going to address those questions and give you the evidence behind penile lengthening treatments. I'm Dr. Emily Watson, MD, urologist and pelvic surgeon. A urologist is a doctor who takes care of the genital urinary tract, both medically and surgically. If you like what you see here, make sure you subscribe so you can see new videos each and every day. Now, did you know that a survey was conducted on 50,000 heterosexual men? And what they found was that 55% of them were unhappy with the way their penis looked. But when researchers asked those men's partners, 85% of women said they were completely satisfied with their partner's appearance. At the end of the day, what matters is how you feel about yourself. But the reality is, pornography has seriously blurred the lines of what is actually normal. I made a video previously talking about average penile length. When you look at all the available data, the average penile length is approximately 5.2 inches, or 13.2 centimeters. It is completely normal for penile length to fall within 2.5 standard deviations of that number, either greater or smaller. What is considered medically abnormal, meaning too short, is anything less than 2.9 inches, or 7.5 centimeters. That condition is called micropenis, and it affects less than 0.14% of the population. It is extremely rare, and it can result from congenital abnormalities, hormonal issues, previous surgeries, or cancer. But today, we are talking about people who already have a completely normal penile length. While it is true that the vast majority of men who are concerned about their size are within the normal range, the real issue is that a significant number of men experience genuine distress around the belief that their penis is not long enough. This is actually a form of body dysmorphic disorder. It even has a name. It is called small penis anxiety. And it does not mean the person has a small penis. It means they have anxiety rooted in the belief that they do. This is defined as a preoccupation or obsession with penile size, where a person spends over 1 hour every single day thinking about it. And for some men, this distress becomes so overwhelming that it begins to affect their daily life. Some end up hospitalized because of it. Some even experience suicidal ideation. This is not something to take lightly. This is a serious men's health issue, and it deserves to be treated as one. Another major problem is that if you go on Google and search for ways to make your penis longer, you will be flooded with websites and information that ranges from questionable to outright dangerous. Many men end up going abroad or seeking out unlicensed providers to perform procedures on them, and the consequences can be devastating. Please do not do that. Seek out a reputable urologist or psychologist who can actually help you. I also want to be upfront with you before I go any further. The Sexual Medicine Society of North America states that procedures for penile lengthening or girth enhancement are not recommended and are considered experimental unless they are being performed in the context of a true micropenis diagnosis. So everything I am about to share with you comes from the urology literature and has some level of data behind it, but none of it is considered standard care. Before pursuing any of these options, please establish care with a urologist who is experienced in this area. I should also mention that I personally do not offer penile lengthening treatments in my own practice. But because this topic matters so much to so many people, I did the research so I could share it with you. There are 2 broad categories of treatment options available: non-surgical and surgical. Starting with non-surgical options. The first, and honestly the most important, is psychological counseling. There are validated questionnaires and structured assessments that can help men understand what normal penile size actually looks like, and more importantly, help them work through the anxiety they are experiencing. What is remarkable is that when you look at men who underwent only psychological counseling and nothing else, the large majority of them no longer wanted any further treatment, surgical or otherwise. That is a powerful finding. If you are struggling with this kind of anxiety, please seek out psychological support first. It can make all the difference. Beyond counseling, there are 3 other non-surgical options worth discussing: penile extenders, vacuum erection devices, and penile injectable treatments. Out of these 3, the only one with meaningful data to support actual penile lengthening is the penile traction device, also known as a penile extender. This is a device with an opening where the penis is placed, 2 metal rods on either side, and a silicone ring at the tip to hold the glands in place. It works by slowly and mechanically applying traction to the penis over a period of many months, and it requires consistent, dedicated use every single day. When men used these devices religiously, studies did show gains in both flaccid length and flaccid stretched length. In urology, we use flaccid stretched length to estimate erect size, and research has confirmed these 2 measurements are very closely correlated. So what was the actual gain after months of daily use? Approximately 2 centimeters. It is modest, but it is real, and it is documented. The side effects can include numbness and bruising, and of course, there is always the possibility of putting in all that effort and seeing minimal results. But of the non-surgical options, this one has the most consistent and the safest evidence behind it. Vacuum erection devices, on the other hand, did not show any increase in penile length at all. And penile injections? I would strongly advise against any of them. Various substances have been tried and injected into the penis over the years, and many of them have led to truly devastating complications. In fact, next week I will be dedicating an entire video to the history of penile injections, what has been tried, what went right, and what went terribly wrong. The data right now is simply not strong enough to recommend any injectable treatment, and complications have been documented as far as 40 years after the procedure. Please, do not inject anything into your penis. Now, moving on to surgical options. Several have been described in the literature. One of the most commonly discussed is a suspensory ligament release, where the ligament connecting the penis to the pubic bone is cut, allowing the penis to hang a bit lower and appear slightly longer. But this comes with real risks and complications. Other techniques involve flaps, grafts, and even rib cartilage to try to increase penile length, and overall, the outcomes have been poor, patient satisfaction has been low, and the studies reporting these results have not been conducted with the scientific rigor we need to draw reliable conclusions. At this time, I cannot recommend surgery for penile lengthening. The only situation in which proceeding with surgery would be appropriate is within the context of a formal clinical trial, one conducted at an institution with an institutional review board, known as an IRB. The IRB exists to ensure that any research being done on human patients is both safe and ethical. It also ensures that adverse events are properly tracked, reported, and published, so that we, as urologists, can look at real data from real patients and make informed decisions about whether a procedure is actually safe and effective enough to recommend. The bottom line is this: there is not a great deal you can do to significantly change the length you were born with. A small gain is possible with consistent penile traction therapy, and the evidence does support that. But there are many other interventions that remain under investigation and are simply not ready for routine use. My strongest recommendation is to start with psychological care. Address the anxiety first, before pursuing anything that is irreversible. Because the last thing anyone wants is to end up with something that is disfigured, non-functional, and worse than where they started. Thank you so much for watching. Make sure you join me next video when I talk about penile injections, what substances have been used, what complications have occurred, and what the real outcomes have looked like for patients. And as always, take care of yourself because you are absolutely worth it.